Hello and welcome. My name is Stephanie Poole. I am a certified lactation consultant and doula. And y'all, I'm super excited for today's episode. Today, we're going to be talking about how to prepare for birth, every single thing that you need to know as a first time mom. It's all going to be chucked inside of this episode. So if you are pregnant, and you are wondering, okay, how should I prepare for birth? And you're not really sure where to get started, you definitely need to stay tuned for today's episode because, baby, I'm going to walk you right on through this thing. All right, let's go ahead and hop into today's episode. Okay, so we are back, and today we're talking about how to prepare for birth, everything that you need to know. I have created tons and tons of content and courses to support and help first-time moms prepare for birth and transition into motherhood. And I'm always excited to do these type of episodes because I feel like it just rings from my soul, because it is truly my mission to help first-time moms prepare for birth. You definitely want to tune in, you definitely want to listen up, and you want to grab these nuggets, because even if you don't decide to work with me or anyone else, this will give you a good template for what you can do at home. And that's always the objective of my content. So with that being said, the very first thing that you need to know as a first-time mom preparing for birth is, number one, just understanding your birth options. So when it comes to giving birth, there's a lot of different options. Typically speaking, the option will be to birth at home, birth at a birthing center, or to birth in a hospital facility. Those are typically the most common ways for women to birth here in the United States and really abroad as well. Home, a birthing center, or a hospital. And you might be wondering, what's the difference? I'm going to hop into it really quickly, just so that you have an idea of what some of your birth options are. And then you can take this information and move forward, do more in-depth research, and figure out which one aligns with you. So number one is to birth at home. This would be for a lot of my holistic mommies who really want to allow the natural progression of birth to take place in a non-intrusive way, meaning you don't care for any kind of interventions. And an intervention would be something like you are not looking to have pain medications. You want that to happen, your labor and your delivery to happen very naturally, without very much intervention from any kind of medical staff or medical devices or treatment. That would be number one, to have it at home. Number two would be the option of having it at a birthing center. A lot of times these are standalone birthing centers, meaning that they are disconnected from the hospital. It is a separate building, a separate place that you would then drive to, so you're not at home. You go to this birthing center, and again, you are using minimal intervention to assist in the birthing process. You are seeking help of a medical professional. You typically have doulas that also work at the birthing center, birthing assistants that are there to assist the midwives for the actual birth. And the natural progression of birth typically happens as close to nature as possible with very minimal medical intervention. So they may offer a few things to help with pain, but typically nothing very invasive. One of their treatments for pain may be to put you in a bath or some sort of water compartment to help with some of that labor discomfort and things like that. So very natural options to deal with the progression of labor as you progress towards birth. And then the baby is born there, and you're discharged from the birthing center to then discharge back home. That is another option. The third option is the most medically involved option, which is to birth at a hospital. Now, although we have three options, the reality is in the United States, 90% of women birth in a hospital. It's not as common to birth at home. It's not as common to birth in a birthing center, but they are an option. To birth in a hospital, there are some, and hospitals are becoming better at allowing the patient to really labor in non-conventional ways. Some hospitals offer the water births and things like that, giving you an option to get into a water bath to help versus just going straight to an epidural. But hospitals are typically chosen if the parent is either one, high risk for any reason, maybe the age or the medical condition of either the mother or the baby. And then also it just could be the preference of the mother. Maybe she wants to have a trained staff in case of an emergency. So that's typically the reason why people choose hospital births. There's usually a hospital located more readily available than some of the other options of the birthing center. So that would be your third option. And knowing this, right, as you progress through your pregnancy is very important. It's very important so you can understand, okay, what fully aligns with who I am and the type of birth I want to have. So keep that in mind, understanding your birth options. Okay. Option 2 is creating a birth plan. Now, if you are in my ecosystem, you should know that I really am an advocate of not just birth plans, but what I call birth blueprints. And I have a whole episode about that as well. So I'll definitely link that below for you to watch too. But essentially, I am an advocate of a plan. Right? We don't get married. Very few of us, at least, decide today that we're going to get married tomorrow. Most people, a wedding, getting married is a life event. And so most people take months and months to plan a wedding, sometimes at least a year to pick the venue, to pick out decorations, to get the bridesmaids together and things like that. If we do all of this for a wedding, y'all, come on now. We have to take birth more seriously. Becoming a mom deserves the planning of creating a birth blueprint, creating something, some type of plan that will fully support you through pregnancy, labor, delivery, and postpartum. And so if you're interested in a birth blueprint, you can definitely check out the episode I'll post below, but then also there will be a link to join my free masterclass. It will tell you a lot of good information and how you can work with me to make your birth blueprint. So definitely check that out, but making a birth plan is essential. Now, finally, what I'll say about it is this. There's no way to control every aspect of your birth. There's just no way to do it. I am a doula. I've been present at, I can't even tell you how many births, tons, right? Lots and lots of babies have been born on my watch. And as much as you plan, there's always going to be some variation, something that you have to just give way for nature, right, to take its course. However, I will say there's not been one single client, not one, that we made a plan for that they regretted having the plan. Why? Because even though you can't control every aspect, having a plan allows you to infuse your birth choices into your birth experience. So you might not be able to control everything, but having a sense of control and influence over your birth experience, we know from research, means that those women who are able to do that are more likely to have a positive birth experience. So when I am telling you the importance of making a birth blueprint, having a plan, that is not just my opinion. Although I stand firm on that opinion. It is not just my opinion. It is backed by research. Definitely consider making a plan. Even if you don't decide to create a birth blueprint, which is what I always suggest, and there's a reason for that. But if nothing else, make a plan, because we're making a plan. Even if we don't write it down, we have ideas in our head of how we would like for things to go, or different things that are important to us. And so don't just let it be in your head. Actually take time to make a plan. Trust me, on everything I love, it will help. No matter what you end up with as far as your birth story, it will help to support you in a way that you will not regret. So that is number 2. Number 3 is building your birth team. And this kind of ties back into part 1, where I talk about your birth options. Once you decide whether you're going to birth at home, whether you're going to birth at a standalone facility, or whether you're going to birth at a hospital, the next decision, right, is to then decide on your provider. And choosing your provider is just the very first step in creating your birth team. And this is so important. And here's the reason why. Because having the right people there that are going to support you, that are going to educate you, right? Because you need people that can help you do something that you've not done before. I'm talking to my first time moms here. You don't know what you don't know. That's the thing about doing something for the first time. You don't know that you need a certain amount of support here or a certain amount of support there. And as a mom, you're relying on your provider to tell you how to have a safe delivery, how to take care of your body. You're relying on them because they're the expert. It's super important that you have a birth team that is going to support you, that is going to educate you, and that is going to really be available for you to lean on in one of your most vulnerable times that you'll ever have as a human. Being pregnant and giving birth renders you very vulnerable at the hands of experts and other people in the room. And so you need to be around people that you trust, around people that you trust with your body, around people that you trust around your family and friends, around people that you trust and that is aligned with your idea of your birth journey. And that is so important. Whether or not you choose a midwife or a doctor, that's going to be important. Whether or not you decide to hire a doula, that is important. Who will be present at your birth? Is that something that your partner will be a part of, or your mother or sister? Or is that something you have already decided, no, that I love them, but I don't necessarily want them during that particular time. And I've had it both ways working with clients. I've had some clients who were like, I absolutely cannot do this without my mom, and I have to have her there. And I've had some clients who were like, I love my mom, but no, it will just be my partner, and I will call my mom and she will be present shortly after in the immediate postpartum, but I'm not requesting for her to be there for the birth. And so it really can go both ways, and there's no right or wrong. The most important thing is, what is your plan? What is your desire? How do you feel, or who do you feel will best support you? Once you make that decision, then you start pinpointing those people. And I would even say beyond birth, if you are looking to breastfeed, then you probably should research lactation consultants in the area. Who is a lactation consultant that you would like to work with? And the reason why is because feeding the baby starts day one. So you don't have a lot of time to pick someone down the road. You need to know, if I can't do this, or if I run into problems, or simply if I just want some support during that time, this is where I'm going to tap in at. Those are all like super important decisions that you need to make now. Now, I will say, in addition to beyond birth, right? Because you have your doctor, you have your doula, you have your family who will be part of your birth team at the actual delivery of the baby. But even past that is when I'm talking about engaging a lactation consultant right away. So you need to research that before you have the baby so that you can, in those early days, discuss any issues with milk supply or latch or positioning. So that's important. But then also you need to consider your pediatrician, because you will need to have a pediatrician in order to be discharged, especially if you are birthing in a hospital. Reason being is because doctors want to know that you're going to follow up within a certain amount of time after delivery, and also to be able to forward those medical records for continuity of care, right? So that everything is pretty much seamless. You need to have a pediatrician already in mind and picked out. So it's important to research all of that. That's part of your extended birth team, because even though your pediatrician won't be there for your birth, or your lactation consultant won't be there for your birth, they should be engaged very early after birth so that you can make that transition into motherhood as seamless as possible. So keep that in mind, planning or building your birth team. Number 4 is preparing your body for birth. Now, I always go over this with my clients as a doula. I offer certain resources. It is so underrated how important it is to prepare your body for birth. And I'm going to go so far as to say this is an absolute must, no matter what your birth option is. So if you decide to birth at home, if you decide to birth in a birthing center or in a hospital, you must prepare your body for birth. I'm going to just leave that there. But I'm going to take it a step further and say, if you are having a home birth or birth in a standalone birthing facility, remember, I talked about those births having minimal intervention. Okay, depending on your pain level, depending on your tolerance for discomfort, there's no negotiating this. If you choose to have a baby at either one of those facilities, it is an absolute must, on top of the must that I already gave, that you prepare your body as much as you possibly can for birth. Those facilities are meant for women that are, 1, not high risk, and 2, will not need advanced medical intervention, meaning that you're healthy, the baby is healthy, you have had a quote unquote normal or unremarkable pregnancy. There's been nothing flagged during your pregnancy or medical history that would point in the direction of you needing any type of advanced medical intervention. It's relying on your body to naturally do what it is supposed to do. What we know that thousands and thousands of years have trained us to understand about birth, that's what it's geared towards. Your body is going to do what we know the birth process is designed to do. But in order for you to have your body work optimally during the delivery process, you have to prep ahead of time. It is not an option for you, and this is just me on my soapbox, okay? It's not an option for you to choose not to have medical interventions and then you not walk daily. You need to be up. You need to walk. It doesn't have to be a vigorous workout plan or anything like that, but you have to move and get steps in. It helps. It helps with the baby as the baby grows. It helps you, and it helps to open up that pelvic muscle and get the baby to start descending before you ever go into labor. You have to do certain stretches that will, again, open up the pelvis and help that baby to come down and start getting into position before you ever go into labor. In order for you to maximize your body's ability to progress in the intended way that we know the childbirth process takes place, you have to prepare your body beforehand. Please, I cannot stress it enough. Movement and stretching is absolutely essential. Paying attention to your nutrition is absolutely essential. Plenty of fruits, plenty of vegetables. All of that is ground one, especially if you plan to not have access to any type of medical intervention. These are just basics that everyone should be doing, but especially if you plan to have a more holistic childbirth experience. The next one I'm going to talk about is what to expect during labor and delivery. If you have not taken a childbirth class, you need to take one. I'm going to just say that. Why? Because you need to understand what to expect during labor, during delivery, and during that immediate postpartum. If you have not taken a newborn care class, those are all things that's super important, because as a first-time mom, as a new mom, you don't know. You don't know. And I think one of the biggest misconceptions, I've talked about this in other pieces of content, but one of the biggest misconceptions is that having a baby is just going to come naturally. It might, but it's not probable. It's possible, but not probable. Okay. Most people have to learn how to be a mother. And thank goodness you have me or people like me. There are people in my profession, and that is what we do. That is what we do. If you haven't taken a breastfeeding class, you need to take it. Those are all very important to help you make that transition into motherhood. You will not regret it. There's a lot to know, and you want to be able to shorten that learning curve. And one way to do it is to dive in and do it like you would do anything else that's super important to you. And that is to become more educated about it. I will leave that information down below. But yeah, definitely really educate yourself in what to expect during labor, delivery, and immediate postpartum. The last thing that I will bring up is that fourth trimester. And essentially, that is what I've talked about in terms of preparing for birth. When you're preparing for birth, you're essentially preparing for that fourth trimester as well. And that is the crux of my program, Bump to Bundle Blueprint. What I saw was that so many women were going into birth with just this plan for the hospital. And I was realizing, like, that's not enough. Like, mothers, you still hear them say time and time again how rough that transition was. I am one of those moms. I was that mom. It was very rough for me. So I created the plan that I wish I would have had, the plan that I know provides that level of support that I give my patients one-on-one. Like my doula clients one-on-one get this plan from me. And there's other things that I do when I'm in person, but I really try to extract all of those important areas to help you not just create a plan for birth, but to create a plan for that fourth trimester in those early postpartum days so that you feel completely supported from beginning to end. Having that knowledge and making that plan is so vitally important that I cannot stress it enough. Without it, it literally makes the difference between having a positive birth experience and having a not so positive birth experience. Yes, definitely make sure that you are planning not just for labor, not just for delivery, but that you are planning for birth and the immediate postpartum, or what we like to call that fourth trimester. So, with that being said, I cannot say it enough. You absolutely should check out the Bump to Bundle Blueprint because it is that good. It is that good. It will help you to plan for this birth and to just help you transition into motherhood. So definitely check out all of the links of the supplemental podcast episodes that can help you with some of the things that we talked about here. You can work with me two ways. So one, if I take a certain number of clients that I teach every month, so you could definitely book a session with me if there are any available at the time that you're checking. If not, continue to check back because I do change my schedule here and there to open up appointments. So definitely check back. Or you can just simply purchase the course, which will walk you through how to either learn about the childbirth process, or learn about breastfeeding, or how to prepare for birth. They are all there to help you during this time. Y'all, I absolutely enjoy being with you today. And until next time, happy birthing. Bye, y'all.